Hello, everyone. Good afternoon or good morning, depending on where you are in the country. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health in Public Housing. I want to welcome all of you to this great topic and this interesting webinar, which is a two-webinar series. We hosted the very first webinar about 2 weeks ago, and now we are very pleased to have an excellent subject matter expert. So I hope that you enjoyed this webinar. The webinar is being recorded and all the resources will be sent to all participants after the webinar is over. Next slide, please. So some housekeeping items. This is a live activity. Everybody is muted upon entry. If you want to ask a question, you can engage in the chat, or you can use the raise hand and your line will be on mute. The meeting is being recorded, and again, the slides and recording link will be sent to all participants via email after the webinar. Next slide, please. The National Center for Health in Public Housing is supported by HRSA to provide training and technical assistance to community health centers. Even though we work specifically with those health centers that are in or immediately accessible to public housing, the training activities are for all health centers, the 14 plus health centers across the nation. Next slide. Just a quick reminder about public housing, primary care grantees. In 2021, the most recent data, there were over 1,300 health centers providing services to over 30 million patients. 458 of these health centers were in or immediately accessible to public housing, and in 2021 they provided services to 5.7 million patients. 108 of the 458 health centers are public housing primary care grantees, and they serve over 900,000 patients in the same year. Next slide. In public housing, we have over 1.5 million residents. 38% of the households report to have at least one person with disability. In regards to the age of those living in public housing, 19% are over the age of 65. 36% are less than 8 or younger than 18 years old, and 32 of these are female-headed household with children. We also have 52% of the population are white, 43% African American, and 26% Latinx. Next slide, please. HRSA and CDC work together and published this great compendium of resources for health centers and public housing agencies. This is the health picture of HUD-assisted adult data from NHANES and NIH survey from 2006 and 2012. It's my understanding that HRSA is, the HUD is working on the most recent numbers, the NHANES numbers, and the numbers will be available by the summer or this of 2023. It's really interesting to note the concerns and the conditions affecting those living in public housing or those in HUD-assisted housing. And we see that mostly diabetes, overweight, and obesity, disability, and COPD are the main concerns, as well as the number of people or the percentage of people who are chronic smokers in public housing. With 33% of those living in public housing are chronic smokers. This is something that we've been working with HUD, with HRSA, with the health centers, with public housing primary care grantees to address the needs, and making sure that the health centers and the patients receive the resources that they need to fight smoking in public housing. Next slide, please. We're going to focus on compassion fatigue. This is just a quick reminder of what we discussed last time, but there were three points that we highlighted, and the 3 points are that during the COVID-19 pandemic, thousands of health workers lost their lives and they put their own health and safety at risk so they could heal and comfort others. And more than 3,600 healthcare workers died during the first year of the COVID-19 pandemic. And WHO, or the WHO, estimates that between 80,000 to 180,000 healthcare and health and care workers could have died from COVID-19 in the period between January 2020 to May 2021. Next slide, please. Health centers are still mentioning that staff burnout and staff shortages are the main concern for them, based on the most recent conversation that we've had with them. Health centers are expressing that staff turnover and burnout are the main concern for all those health centers, not only those located in or immediately accessible to public housing, but all health centers. That's the reason why we believe that this is a very important topic, and there is the need to provide additional information about burnout, turnover, compassion fatigue, and those topics that are linked or associated to this particular issue. Next slide. Now it's my pleasure to introduce today's speaker. We are going to hear today from Amelia Rochline, who is a skilled licensed clinician who has led healthcare teams in mental health and substance use services programs for 20 years. She's currently faculty at the University of Southern California and excels at developing and implementing programs in healthcare settings. Amy has published research and spoken at numerous state, national, international conferences on interpersonal violence, co-occurring disorders, trauma-informed care, compassion cultivation, and leadership and team-based healthcare. She's a member of the British Psychoanalytic Council's list of qualified mentalization-based treatment practitioners and active in the American Association of Marriage and Family Therapists, American Academy of Social Work and Social Welfare, and the American Interprofessional Health Collaborative. She completed her doctorate at the University of Southern California with a focus on innovation and creating large-scale social change through transdisciplinary training and mental health practitioners. Amy, good afternoon.
Thank you so very much, and it's so great to be here with you all. Really excited to jump into this information today. Let's go ahead to the next slide. And so today we're going to be talking about, how can we take this idea of compassion fatigue and feeling burnt out, and what are some of the practical ways using literature and some of the latest science-based research to help us really not only decrease burnout and stress in our lives, but actually increase well-being and self-compassion and resilience. On the next slide, you'll see that we have a poll for all of you. And this is really, I know that we're going to be launching it in just a second, but I want you to think about what do you think contributes most? So we want you to only pick one of these. Certainly all of them are helpful to creating safe, nurturing, and thriving work environments. Which one might you imagine is the most helpful? We'll give a moment for that to launch. And I also see in the chat or in the Q&A that I had actually put in and asked you all to share it from each other, not realizing that the chat was disabled. So sorry about that, but please feel free to go ahead and throw any questions into the Q&A, and we're happy to answer them as we go today. And we'll also leave time for that. All right. Perfect. All right, so we're going to go ahead and look at the results of the poll here, and it looks like, we've got brilliant people on today, that the highest percentage went to connection in regards to the bonding and engagement that we have with each other in the workplace. And you all are absolutely right. That is the thing that actually contributes to having safe, nurturing, and thriving work environments and culture. Number two is actually curiosity, which it looks like no one listed. So I'm excited to jump into today about what the research shows, and then also get some of your real life examples as we go. We can go ahead to the next slide. And this is just going to outline what our learning objectives are today. And really, we're just going to, again, be talking about some strategies and practical ideas that hopefully you can actually use this afternoon. We want to do things that are really applicable to your daily lives. One of the best tools that I know, we can go to the next slide. Thank you, Fide, for updating the chat as well. So folks are more than welcome to use that process as well, so we can get a sense of where everybody's at. All right, perfect. So on this slide, this is one of my favorite tools to use. This is a change package that we created a few years ago that was really developed with the help of Kaiser Permanente, where we put together what it truly means to be a resilient organization or a healing organization. And what's so wonderful about it is that it has these different objectives and change initiatives that you can apply, whether it's for you individually, for your immediate team, or across the organization or community as a whole. And we're definitely going to dance through what some of those are today. We'll also have a link to that resilience and recovery package at the end of the slides that will make sure everyone has access to. So let's go ahead and ground our feet in this. We can go to the next slide and just talk about what are, some of the impacts of stress. What do we know? And I really like to lean into neurobiology around this. So let's go ahead to the next slide. This really starts from some of the latest research around bias and around the way that we view the world and ourselves. So we can go ahead to the next slide. Perfect. All right, so the way that the brain processes the world is we're constantly looking out for threats or rewards, right? And so when we're at work, that can look like, a workplace threat could be like a project that you're working on going badly, maybe a patient or a person that you're working with is not doing well, the dreaded getting a message that your boss needs to talk to you right away, or if you're in a meeting and people are talking over you, right? All of those can be interpreted by your brain as threats versus workplace rewards, right? This is where, people are interested and curious about what you're doing. You might have a project or something you're working on that's going towards completion. You might be up to date on all of your notes, right? The problem is that when we feel threatened, right, we retreat back to what we know. In other words, because our brain is constantly and unconsciously obsessing about social threats, it can be very challenging when we experience threat to think clearly and to calm ourselves down. We can go to the next slide, please. So this is one of my favorite images. It comes to us from Bruce Perry, if any of you are familiar with him. He put out a book with Oprah a couple years ago. So now he's a bit of a rock star, but he's a neurobiologist who really, him and his team have been studying, the impact of stress on our brains for a long time. And if you notice this inverted pyramid on the left-hand side of your screen, this is the brain energy that all of us have on any given day. This is our brain when we're not in crisis, kind of how when we're not stressed out, a normal brain performs. And you'll notice that the majority of the brain energy and blood flow is going to our frontal cortex or cognition, that ability that we have to be curious and unknowing and to use all of our emotional intelligence as well as our intellect. To a slightly lesser extent, it is the part of the brain that I've spent most of my career in, which is our social emotional reasoning. So this is our ability to kind of do two things. One of them is to be curious about what's going on inside of ourselves, right? Having that capacity to be like, gosh, why did I have such a strong reaction about that? And the capacity to kind of look outside of ourselves and look in to see how we might be reacting to things, or looking at others and imagining what might be happening internally for them. So if I was working with Dr. Leon and I walked by him in the hallway and he looked particularly stressed out, or maybe he kind of furrowed his brow and looked away from me, and I knew that he was working on some really high profile things, and he was under a lot of stress, if I was calm, I might be able to put those two things together and have an empathetic response, maybe even reach out to him and try to soothe him or see how I might be able to. And again, we can do all of this when we're calm, because most of the brain energy is going to the frontal cortex and the midbrain, and very little energy has to go to our regulating our physiological sensations as well as our survival brain. However, when we're in high stress, okay, when we're overwhelmed, or when we're in crisis, the brain does exactly what it's wired to do. And this is what we see on the right-hand side of the screen with the pyramid, right? And so what ends up happening is not only can you not think clearly, right? I don't know if any of the rest of you have had brain fog off and on again over the past few years. Just the other day, I was typing an email, and all of a sudden I realized that I kind of went off into space and then came back and realized, like, wait, what am I doing again? Or I'll go upstairs to the kitchen to get a glass of water, and by the time I get up there, I forgot why I've gone into that room, right? Very normal when we're under high amounts of stress. All right. Same thing with our emotional and social reasoning. So if any of you have had the experience where you might have a strong emotional reaction, but maybe not be able to have any curiosity about it, or maybe you came off a little bit harsher than you meant to, it's very normal when we're stressed out. It also means, and this is one of my favorite things for us to really hold on to, is that we tend to really get really challenged with being able to read others when we're stressed out. Okay, so if I had that same walk by Dr. Leon and he kind of looked away from me, if I myself was stressed out, I might come to all kinds of conclusions about why he might be mad at me or what a jerk he might be, and really not be able to kind of use my frontal cortex at all to kind of tie to being curious about something might be going on inside of him and not have anything to do with me whatsoever. Not only that, but we've actually found there's something called the neutral face experiment. And some of you might be familiar with this, some of you might not. It is focusing on attachment research. And what they really found was that when a group of subjects, and they've done and replicated this study all over the world, all over with different types of races, ethnicities, religions, and what we find over and over again is that when we're calm, we are pretty good at interpreting facial expressions for the most parts. Particularly, we're able to read neutral face expressions. So imagine the face of a Mona Lisa, right? Not a lot of affect, maybe a hint of a smile, but nothing more. When we're calm, we're able to read that as a neutral face, right? Not a lot of emotion going on. However, when we get stressed out, when we're in crisis, time and time again, we read a neutral face as aggressive, right? So let me say that again. When we're stressed, if someone else is hard to read, we're oftentimes going to default to thinking of it as aggressive or being against us. And I can't help but assume that because we are communicating more and more than ever before in more neutral ways, right? Thinking about email use has gone up by over 500%. Text message use, right? These are very neutral ways of communicating. And unfortunately, we are more apt to read threat into them because of the way that our brains work. And that's because all of that blood flow and brain energy is going to really getting us ready to go into that fight, flight, or freeze response. If we take this idea and go one step further, let's go to the next slide. This is that same idea, but we're going to place a little bit more neuroscience on top of it. This is the triune brain theory. And I want you to think about this like a ladder that we all go up and down every single day. Doesn't matter if you're an infant, you're a teenager, or the president of the United States, all right? So every single part of every day, particularly when we are awake, the brainstem is constantly sensing what's coming in and what's going out, and it's asking the body over and over again, am I safe? And when it says, am I safe? What it means is, do I feel physically safe? Do I feel psychologically safe? Do I feel morally safe, culturally safe, socially safe, right? These are all the different types of safety. Doesn't matter if you're, at your home office, if you're driving in your car, you're in the clinic where you've been a million times before, or you're somewhere new for the very first time. And if the brain says, yes, in this moment, I feel safe, then you can climb up that ladder and really go to the next chapter of the brain, which is that limbic system where emotion and memory are stored. And what it says on the slide is, am I loved? But what it really is asking is, do I feel connected to those around me? Am I understood? All right. So again, doesn't matter if I'm home, if I'm at work, or someone else. Only once I feel safe and then connected and understood, can I actually climb up a little further to be in the thinking brain or in a window to provide meaning making or seek meaning making, to use our frontal cortex. In other words, we can't produce, we can't work without having these foundations served. First, safety, then connection and understanding, and then to production. And we want to remember that, this isn't just about the clients that we serve. This is about you, your staff, your family, all of us fit in this space. And so if I am, say, working by myself, writing my notes or what have you, and all of a sudden my phone tells me the latest horrific thing that's happened in the world, well, now I'm instantly probably going to fall back down that ladder and start with, am I safe? And I'm going to have to quickly, probably start to doom scroll to see what's going on. Do I know anyone who's been hurt? Am I in danger? And then likely I need to connect with someone about it before I'm actually able to get back into a space of productivity. The same could be said if I'm in a meeting. Say we were in a meeting together and I feel brave enough and courageous enough to maybe share an idea or pitch something. And if I get talked over or dismissed, likely I'm no longer going to feel connected to the people around me. I might feel misunderstood. And if that happens consistently enough, I'm no longer going to feel safe in that workspace. All right, let's go ahead to the next slide. And we can go ahead and click. Perfect. So again, under stress, our brain goes into that fight, flight, or freeze mode, that basic survival response where everything shuts down, except for keeping ourselves safe or avoiding things. One of the most important take-home messages from today is we really can't think our way out of being stressed, right? If you or the person that you're working with or the person that you're serving is in this stress response pattern, we really can't respond, learn, or process. Some of the best things that we can do is to walk away, go for a walk, anything that we can to let these chemicals drain So then we can come back and get back up that ladder to connect when we're no longer in the red zone. And unfortunately, a lot of the interventions that we are trained on, a lot of the assumptions in our current policies and procedures are really relying on reward or punishment. You know, this idea that behavior is intentional when really behaviors are elicited. So it's important for us when we're thinking about resilience and well-being for us to change our paradigm and realize that some of the things that make us feel most pushed away at work or when we're working with clients or each other is, you know, sometimes we see it as symptoms. They're really adaptations, right? And we can't think our way out of it. Oftentimes, we really need to make sure that the downstairs of the brain, right, that need for safety and for connection and understanding has to be online before we can get into the upstairs of the brain. I want to go ahead, let's go ahead to the next slide. And I challenge you all to think about this for a moment. You know, I want you to think about, you know, what is one practical way? This might be some science you're already familiar with, but, you know, hearing this again, is there any way that you can think about in the way that you work that you might need to start doing or stop doing that aligns with this basic science of the lab? Right? Anything that goes against this or things that you might like to try doing. Or maybe you all are innovative and you're already starting to create some of these things. Oftentimes we see health centers you know, being really mindful about at staff meetings, making sure that you have a moment of mindfulness before you jump into talking about things. If you're a clinician or a coordinator, a connector for the population that you work with, making sure that your brains are both regulated before you jump into doing business. So I'd love to see in the chat if you have ways to, you know, some of the ways that you're bringing this science into your daily work and things that you know have started doing or things that you think that you might need to stop doing that better aligns with this science. While we're doing that, we can keep moving on. On the next slide, you know, oftentimes it's important for us to remember that we have our own traumatic histories, right? We're not robots. You know, oftentimes, you know, we will, and certainly when we think about, you know, the adverse childhood experience study and all the other research about trauma and burnout and stress, it doesn't really distinguish between patients or clients and staff. And so all the data that we've seen that almost 70% of the population has experienced at least one adverse childhood experience before the age of 18. It includes everyone, the people we serve and the people that we serve next to. You know, many times we've got our own traumatic histories, and those can create situations where we seek to, you know, avoid re-experiencing our own emotions, that we can respond personally to others' emotional states and perceive things as personal threats or provocation. And of course, because of this, you know, it all makes sense. You know, we're humans as well. We can go ahead to the next slide. I know that you had a wonderful presentation on this a few weeks ago, but just want to highlight, you know, some of the jargon, some of the terminology, whether it is secondary traumatic stress or compassion fatigue, or we're thinking about vicarious trauma. You know, you all work with some in really challenging situations. Certainly the pandemic has made this even more challenging, not to mention the high amounts of toxic stress that are continuing to exist in our lives today. And whenever I see this slide or these definitions, I think it's also important for us to recognize, not only that these exist, but what some of the ways that we adapt to experiencing these things, whether it's nightmares or insomnia, or having a sense of hopelessness or irritability, difficulty, focusing, having more of an appetite or less of an appetite. And all of this is completely normal given the situation that we're in. We can go ahead to the next slide. Those of us that are experiencing compassion fatigue or burnout or vicarious trauma, oftentimes I'll hear that, that every day kind of seems to be a bad day. We feel fatigued or exhausted all the time. Reduced empathy, towards the people that we serve or work with, or maybe kind of feeling disconnected, having the sense of apathy towards our work life or our home lives. One of the hardest things is when you feel like the majority of your workday is being spent either on tasks that are mind-numbingly boring or, in contrast, completely overwhelming. And so when we're in this burnout curve, when we're experiencing this, again, this is a normal adaptation to experiencing toxic stress. And so because of that, there's something else that oftentimes we don't necessarily link to this in the literature. Let's go ahead to the next slide. And this is some of the things that can happen to us that also plays a role in this.
Amy, before you continue, there are two comments.
Oh, please.
From your previous slides, if you go to the chat.
Oh, thank you. So yeah, I'm seeing that having a client that is causing a lot of stress for this individual. And I love how Alicia has really realized, like, hey, this isn't someone that I'm going to be as effective to be able to meet with first thing in the day. And so now making sure that she's had lunch and hopefully not only just nourished from food, but also having a break and can really approach her with fresh eyes, I think that is an incredibly effective way. And then also seeing, making sure that setting boundaries with folks, that you can only respond to phone calls within 48 hours, that you're not just sitting there on the phone waiting. So this is great. Really love to see some of the ways that you all are taking care of yourselves. And still, if there's anyone else who has some of those techniques that you're willing to share, I think that's really important. Now, going back, let's go ahead and click on the next slide. When I say what has happened to you over the past few years, what I mean by that is that you've gotten messages of not doing a good enough job, having never-ending bureaucracy and paperwork, maybe having hypocrisy in your workforce or at work. I have to tell you all, I worked in an academic medical center setting for about 15 years. And our tagline that was written on the pencils or pens that we used, it was written on the hallway, it was even written on my lunch bag, was "We care." And I have to tell you, it was very hypocritical. As a faculty member, my experience was that they did not give a hoot about me or the other people that I worked with. And sometimes I felt like they didn't really care about the patients either. So, not being able to talk about this, having experiences of hierarchical work environments where you're being dismissed or not being seen as important, or when you're having to choose between working and bringing home a paycheck, or staying at home and taking care of your family members or taking care of yourself, right? These are things that many of us have to deal with every day. And this is really what moral distress looks like. On the next slide, these are certainly some of the impacts in the literature around the impact of moral distress on organizations. There was a recent survey that came out that said that 70% of workers within the helping field took their last sick day because they needed a mental health day, not because of a physical health issue. About 68% of folks who experience compassion fatigue are full-time employees, and 81% of the folks who suffer from compassion fatigue are women. One of the most important parts of that, I think, is that the development of compassion fatigue, the greatest factor that was identified in what created that was the lack of perceived fairness in the work that was being assigned. So we know that this leads to not only to burnout, but it leads to the issues that we're having with recruiting and retaining good employees, as well as the idea of burnout relating to race and ethnicity, right? The phenomenon that sometimes we hear is this idea of brown burnout, right? Where employees of color tend to experience more compassion fatigue, higher amount of burnout than their white body counterparts. Now, when we think about this, we really need to make sure that we have a clear understanding of what moral safety actually is. Let's go ahead to the next slide. I think creating a morally safe helping environment is probably more challenging today than it's ever been. So when I say, this idea of moral distress or moral injury, what I mean are situations where you know what the right thing to do is, but doing it is thwarted by some type of constraints, right? This is when we got to act in a way that goes against what we feel like the right thing to do is. And therefore, we end up having this sense of feeling responsible, but we can't change what's happening. Versus a morally safe environment is one where you're able to do your work because you've got a sense of integrity. Your sense of what is right is supported by where you work, and most importantly, by the person or the people who directly supervise you. The problem is, what is right is likely to be perceived differently depending on who you are, your experience, and where you are in the hierarchy of the organization, right? And, this is a fundamentally important quest in the workplace. And unfortunately, a lot of the work that we do, this idea of creating morally safe environments, is even more challenging than it's ever been because of the reality that we are working within these incredibly large bureaucratic structures that have been created for greater efficiency, right, in handling large numbers of folks. But it actually dehumanizes the people who work there or the very people that the organization is supposed to serve. And so it's not easy, and it's not a quick fix. Now, what's interesting is in the past few years, there's actually been more and more research around this, particularly in the public health sphere. And what we found is that the most important thing that you can do is have a conversation with the teams that you work closest with, right? Being able to share about how this feels, being able to engage in an ongoing discussion with the issues of integrity, maybe taking a step back and having a self-evaluative look at our therapeutic or health-related presumptions, our training, our rationalizations, our fixed beliefs, as well as our practices. And we have to look at the relational web that forms the structures of our workplace. So the best thing we could actually do is to point out these hypocrisies with not only our teams, but with the people who directly supervise us. Asking, Are the means getting us to the justified ends? Or to the desired ends? Do the means justify the ends? And do the activities that we're prescribing lead to autonomy and connectedness and empowerment? Or do they lead to dependence or alienation or helplessness, right? So again, it is probably unlikely that we're going to get rid of all the hypocrisy that exists. But what's important is being able to note it and explore it with each other, right? That is what takes away that sting or that pain of moral injury. If this is something that you've explored or that you're interested in looking into more, I highly recommend you look at our Change Concept 1 in that Fostering Resilience change package that I talked about. This is about helping all individuals feel safe and secure and develop trust with each other. And I'm appreciating these comments in the chat, looking at self-pay or, the way that we do intake, where we feel like folks might not care about the patients as much as the bottom line, right? We need to be able to have conversations about this within our workspaces. And even if we can't solve them, it's having the conversation and feeling connected about it and understood is what actually takes away that moral injury. Here's another one that comes up a lot. Let's go to the next slide. This is about creating a safe and secure environment for everyone. In other words, we have these parallel processes that in the workplace, if I feel safe as an employee, if I feel that I can try something innovative, that I have a say over what my job is and how I do it, right? Modeling that desired relationship that we want to have for our clients or our patients, having that modeled, that healing relationship modeled through the use of supervision and with our teams, right? That is what actually creates this for our employees. And I have to tell you all, I have gotten this wrong. For years, I would write grants for programs and say that we were trauma informed because a lot of the clinicians I worked with were trained in trauma informed interventions for the clients or for the patients, right? Well, guess what? If you're not trauma informed for your staff, there is no way that they can be trauma informed for the patients, right? If they themselves are experiencing acute stress, moral injury, there is no way that they're going to be able to create those spaces for the clients. And this really means that we need to create an environment that allows for growth and an environment that allows for innovation and sometimes getting it wrong. On here, you notice that I highlighted mistakes are made here often, right? When we work with children, we have a high acknowledgement that they are going to make missteps and they're going to struggle along the way. But we have this fantasy that once we become professionals, that we never make mistakes, right? And because of that, when a mistake is made, we tend to silo it and not share it. We certainly don't share it across departments within a greater organization. And we really have to work against that. The work that's most innovative that's happening means that we actually share when there's a failure, when there's a mistake. We want to share that loudly with everyone else without shame. Otherwise, we're going to continue to keep these things silent. On the next slide is the idea of being culturally humble. Right? This is one of the ways that we need to exercise universal expectations. In other words, what if we presumed that everyone we serve with and all of the patients that we serve have a history of complex traumatic stress and are actually undergoing toxic stress right at this moment, where we could actually create a system of care that we could actually have our one-to-one or any communication that we have with each other. that not only doesn't prevent more harm, right? But actually can really create some good as well, right? The idea that, programming for those patients and for those employees among us that might be experiencing the most harm, and then work from there. Part of how we can do that is starting to think about resilience. Okay, so the next slide is our change concept 3, where we build compassion and resilience in the workforce. And what I have on here is not only the idea of compassion resilience, being able to have this reservoir of well-being that we can draw on difficult days or in hard situations, but being able to be present and effective even on days when everything goes right. And I love this idea of compassion satisfaction, right? This means not only do I not feel burned out or stressed, I actually experience joy and pleasure and energy from doing my job. Right? And some of you might know how intoxicating this can feel. It's that buzz that you get when something goes well or when you have a moment of joy at work. We want to have more of that and foster and create more opportunities for that throughout the workday. Next slide, we've got a quick thing going back to something that was talked about a few weeks ago at the first training, which is the ProQual, the Professional Quality of Life model, which is really a widely accepted model for understanding the impact of trauma or stress on caregivers. All right, so it was originally developed for caregivers, but now I have to tell you, a lot of people use this in their daily lives, whether or not they're caregivers. On the next slide, I wanted to share with you all that this is actually an app now. You can download it absolutely for free. And so all you have to do is go to the App Store and type in Provider Resilience app. You can give this to your patients, but you can also use this within your teams at work. And it's almost like taking your temperature every day to get a sense of where are you at in regards to compassion resilience and compassion satisfaction, and where are you at in regard to compassion fatigue, right? This is a great way to track resilience over time. And before we go to questions and answer, I want to give you just one other little idea. Let's go ahead to the next slide. I want you to think about what you're doing at work when you feel most alive, most like yourself, and most joyous. All right. Maybe it might be a recent time where you've been with your coworkers and you feel particularly connected and understood, or maybe it's with a patient, something wonderful happening there, right? I want you to think about when you go home from your work day, do you have a tendency to share what happened during your day that made you feel most alive, most joyous, or do you share about what made you feel most drained? Because our bodies experience the stress that we relive in our conversations or in our thoughts to some degree, almost as if we're experiencing it again. You know, we have a choice about how much time and on what we focus when talking about our work. So a practice that I really encourage you to play with over the next week is to include what made you feel most alive or most joyous in your day as you talk with friends and family. And if you happen to live alone and you don't always see someone at the end of the day, maybe even writing it down and journaling about what was one of the events that made you feel most alive or most joyous throughout the day. And see, again, if this starts to shift you to feeling more engaged, more connected. With that, we can go ahead to the next slide. I want to highlight a few things for you here that are some of my favorites. So at the very top is our resilience and recovery change package. And you'll notice that several of those skills we use throughout the slides today, and certainly can go on that. It's a wonderful resource for you. Also, the bottom two resources I want to highlight. One of these is a toolkit that we created with others called the Compassion Resilience Toolkit. And what's so cool about this is there's one for schools, there's one for families, and there's one for social service providers. And in those, it really breaks down even how you can bring resilience and compassion resilience into a staff meeting, into the way you start your day at work, and into the way that you close it. So there's 100 or more different tips, ideas, and resources in there, both for your professional life, but also for your personal life as well, and the rest of your family. And then finally, the final resource is the neurosequential. This is that brain-based stuff that I talked about at the beginning. There's over 20 different short videos that you can watch, both for you at work as well as for your own personal lives, of ways you can hack your brain to bring more resilience into it. With that, I want to open up to see if anyone has any questions, reflections, ideas. I know we went through like 2 semesters of neuroscience and then rapidly through all of the resilience research that's out there. I tried to include links and references to absolutely every study that I talked about today, but questions that you all might have.
Thank you, Amy.
You're welcome.
Thank you so much. This was a great presentation and a lot of resources. If you have any questions for Amy, again, you can use the Q&A feature, or you can also raise your hand and your line will be unmuted.
While we're doing that, if it's okay, one question that I get a lot around this that I haven't talked about yet is, are there ways that we can use technology to help with resilience, right? And so there's 2 that come to the top of my mind right now. So one way is thinking about using an app that will have your phone buzz or a nice soothing sound that goes off about once every 15 minutes that reminds you to breathe from your belly. Like it or not, our capacity to think clearly and to have resilience is directly tied to our ability to keep ourselves calm. And the best way to keep ourselves calm is to make sure that we're breathing from our diaphragm and not from higher up in our chest. So that's a really great way to hack it. The other one is, these days we've got people who work around the clock. Many of us, have our work email tied right to our phone. We're answering emails, or your boss is answering emails, or messages in the EHR 24/7. Every single email service, at least out there, has a wonderful tool that you can use, that all you have to do is click a button to have any emails that you work on, even if you're working outside of work hours. Okay, I can't exactly ask everyone to stop doing that, but what I can do is ask you to click the box, so then that way that email, even if you send it from your, at whatever time you're working on things, that it won't arrive into that person's inbox until they're set to work the next day. It's these little things that we don't think about, like getting those emails in the middle of the night or when you're on vacation, that actually do create and bring more stress into our lives. So thinking about how we can use some of these tools, particularly technology, is really important. Oh, I see the question in the chat about, we do need to have a technology break by the end of the day. What's the best non-tech method that I can suggest? The good and bad news is that a lot of us have, these blue light reading glasses, and there's ways that you can hit your screens to not emit as much light necessarily that can create some of this toxic stress for ourselves. But I think, using the body is the best way that we know to protect ourselves. So whether it's being in nature, engaging with another human being through non-tech methods. A lot of people like to go out into nature or take a warm bath. I think using the body is always a wonderful way to kind of take a break from technology. But as an attachment researcher, I have to say the absolute most potent way to de-tech ourselves and to feel better in the moment is to lean into another trusted person. So even if you have to do that through a phone call or through a video session, by leaning into someone else, that oftentimes is the quickest way for us to feel de-stressed. Any other questions?
Okay, so we don't have any other questions.
Great. I just want to highlight again, I encourage you to peek through the recovery and resilience package. And when you're in there, if you have questions, or if it seems like something that you'd actually like to do or learn more about, I've included my email on here as well. I'm always happy to talk about it or to answer questions. And there's tons of really great free resources that are out there. So please don't hesitate. This is something that I feel really strongly about. I think no longer can we kind of see some of this well-being or self-care or resilience practice as something that we do outside of the workday. I really think we need to bring this into the way that we work. Otherwise, we're not going to be able to stay in this field. It's just not sustainable.
Thanks, Amy. Next slide, please. Please don't forget to fill the post-evaluation survey. This has been a great presentation, and we want to hear from all of you. Next slide, please. You can also visit our website. You can find information on upcoming webinars, learning collaboratives, publications, and the recording of all the activities that we've done, including this one that is going to be posted on our website, www.nchph.org. Next slide, please. Also, you can contact us, and I'd like to thank Amy for, sorry, Amy, it seems that there is a last minute question here. No, it's just an anonymous attendee saying thank you so much. So once again, Amy, thank you for your expertise, for your time, and for sharing all these resources that I am very sure, that health centers will go and review all the publications and the app. It seems very interesting.
Thank you
so much for all participants. Thank you, and have a great afternoon, and enjoy the rest of your day. Thank you.